Hello, good evening, everybody. I am Professor Suzanne McDonough, and I'm delighted to welcome you to our alumni gathering, which has obviously had to be a virtual event this year. Hopefully next year we'll all be able to meet up in person. So I'm just going to give you a very brief introduction and a little bit of an overview of some aspects of the school. So if I could have the next slide, please. Thank you very much. So the vision for the school is we're aiming to build an internationally excellent school, which is at the forefront of physiotherapy education, research and innovation, and that's responsive to local, national and international priorities. And as part of that effort, we are planning to do a deep curriculum review towards the end of this year and into 2022. And this is where we're really interested in maybe getting feedback from you, really to reflect the new and emerging areas of practice and making sure that future students who come through the school are really fit for practice. And we've also planned a detailed 5-year school strategy. So if I could, next slide, please. So this is just an overview of the school. So I suppose the big difference maybe for some of you who have gone through the school already, our size of the school is pretty much as it has been, but where the biggest change might actually be around our research activity, so around the numbers of postdoctoral and research assistants. That we have 5 at the moment, and our increasing number of postgraduate students. So you can see we've got 5 PhD students and 13 students doing either a diploma or an MSc with us. In terms of our research profile, the school has brought in over 3.4 million euro in funding. And I'm going to talk a little bit more in the subsequent slide just about our publications, but we have really excellent collaborations now, both nationally, and we're working with many of you in the local hospitals in terms of the research we're doing, but also lots of international collaborations. And I'm going to share with you an exciting visitor that we're going to be having to visit the school, hopefully sometime this year, but might actually have to move into next year, just depending on COVID. So if I could have the next slide, please. Thank you. So we have Professor Donald Newman coming to visit the school, and those of you who work in musculoskeletal medicine may be very familiar with Professor Newman's contribution to textbooks. So he's written the kinesiology of the musculoskeletal system. I know we use it for teaching the students, and many of you may be using it in practice. His areas of expertise are anatomy and kinesiology, and he's also contributed to Gray's Anatomy with respect to hip anatomy. So this has been a bit of a shifting event. He was due to visit us obviously earlier, but because of COVID it keeps having to be delayed, and the latest was he was due to come to visit us between July and October 21, but obviously that may change. So look out for more information about his visit and events that we'll be running linked to the time that he's going to spend with us in the school. So next slide, please. So I just wanted to give you a little overview of the research activity in the school. So this is just an overview over the last period of time since 2015. And in terms of our activity, it is increasing in the school, and we can see that both in terms of the grant income the school is securing and the numbers of PhD and master's students who are coming through the school. And the reason this is important is because it really allows us then to feed this research back into the teaching that we're doing. So we're making sure that the undergraduate students are really getting the latest developments in terms of research. And I think it's very heartening to see that the research in the school is really holding its own. So if we're comparing ourselves across the board to all the research that's done in Rcsi, we are comparing really well. So some of the indicators of research strength are the number of international collaborations we'd have on our research publications. So you can see here that for the whole of Rcsi, that's at 53%. and within the School of Physiotherapy, it's sitting at 51%. And the other indicator of research excellence in the school is the numbers of papers that we publish in the top 25% of journals. So these are the journals where it's much more difficult to get your work published, and so it's quite competitive. And you can see that overall, Rcsi published 65%, and the School of Physiotherapy is publishing 64% of its papers in the top 25% of journals. And so if you just move to the next slide, please. So I just wanted to give you an overview of the research staff that we have in the school. Now, some of you may know these staff, or you could be one of those people on the event tonight. So many of you will know Vanda Cummings, who's working with Professor Horgan Francis, and she's looking at functional status and physical activity in older adults. Aoife Stevenson and Philip O'Gorman are working with myself, and our programme of work is around maintenance of physical activity across a number of different health conditions, and we're particularly interested in people who've multiple or multimorbidity. Joyce Cunningham has just started in post with Helen and is looking at a model of care for arthritis in primary care. And then Kathy Wise, who's working with Grace O'Malley, looking at how best to facilitate the integration of childhood obesity services in primary care. So, you know, having these staff within the school has an impact not only on the education that we can provide for the undergrads, but obviously will also help to build our research profile. So if I could share the next slide, please. So just to finish off, I've just given you a very brief overview of the path we're currently following in the school. And I want to reach out to you as alumni to say that we're really, really keen that we do this in partnership with you. So, you know, please do keep in touch with us, and occasionally you might get a survey or two from us, and we'd really welcome your views and opinions so we can reflect them in the school as we develop over time. So thank you very much. So we're just going to hand over to Helen French, who's going to do the Rcsi School of Physiotherapy Highlights and Lowlights 2020.
Thanks very much, Suzanne, and just a big hello to everybody who is online tonight, and for those of you who will be listening back to this recorded version, we're delighted we can do this, but disappointed, of course, we can't do it in person. And before we kind of move on to our guest speakers, our three alumni, who you're probably more interested in hearing about than us, I thought I would just run through some of the highlights and unfortunately some of the lowlights of the last year. So Laura, if you could move on to the next slide, please. So I put this up really just because this just seems like so long ago, and this was at a time when we could do this, when we could have a lot of people together in close contact, and this was the transition year programme that we run annually, which is focusing on kind of physical, mental health and physio related themes. Louise coordinates the programme, and I really just kind of wanted to remind us and remind you online that when we could do this, and there was, you know, lots of activities going on, of course, before COVID hit. So moving on to the next slide, please, Laura. And then, of course, this happened, and I guess our year changed dramatically, as did everybody else's. So moving on then, Laura. So what we had to do in March was really move to a virtual campus, which was instigated at a national level when the then Taoiseach announced that they were closing all on-campus activities for the remainder of the academic year. So we very quickly had to move to online teaching. We were using a Blackboard Collaborate platform. The clinical placements ceased on all sites, and we had to revise all of our examination formats. And we had a very steep learning curve during that period, really from March until the end of the academic year. But luckily, the college and the IT department had really prepared us actually in advance. We were very lucky that they had kind of foreseen that perhaps we were going to go down this route. So this is just a quick kind of an infographic shot of, you know, something we kind of put together. It was really Dr. Ailish Malone put it together in terms of, you know, our experience of the whole transition to a virtual campus, and all the kind of tips that we learned and we tried to pass on to others. And we shared this through a HSCP blog around that time. So moving on then, Laura, to the next slide. Unfortunately, around that same period, we learned of the news of a graduate of ours, Arwen Sullivan, and I'm actually going to talk about this a little bit more in a few more minutes on behalf of her friends. But we were really saddened to hear of this news, and that was definitely one of the lowlights for us this year. So moving on then, Laura. So in relation then to, as we kind of moved through the summer and we started to think about the new academic year, Rcsi were really responding to the COVID challenge about trying to get our students and staff back to campus in some shape or form. And this was really what our campus started to look like in September. In terms of, we were lucky we got the Houston lecture theatre for all of our physio lectures, so we were able to socially distance. And, you know, there was obviously all of the things that you're all familiar with in the hospital sites. We were mandatory face masks, perspex screens where we were teaching, you know, at the podium, lecterns in the lecture theatres, clean as you go policies and so on. And this was all really kind of to prepare for the return of the students in September. And next slide, please, Laura. And we also changed our kind of physical teaching. And it was a very different academic year, and it still is a very different academic year. And some of you may recognise the movement lab here. It might look a bit bigger because it is a little bit bigger. And what we did was we extended it out and we put in a camera systems, and it's hard to see on the picture below, but there's actually a camera from the hanging from the ceiling, which means you can zoom down and do close-ups videos and live streaming, like live recording. So in terms of preparing our students to ensure they still had that kind of practical experience, our students were either going to be on campus 2 or 3 days a week, depending on the year. The Houston Lecture Theatre became the physio homeroom. That was their dedicated space for lectures, and they could also study there. And then we repurposed that practical teaching where we were able to record lectures and practicals, and in these practical rooms we were able to record practical sessions, and we could live stream to students who were remote, maybe who had to self-isolate. So really we had to do that very quickly, but it's certainly been a big transition for us and for the students this year, but we're trying to give them the best experience possible. Next slide, please, Laura. And so we also had to adapt our teaching, to kind of as well. So for example, the practice education team developed a telehealth module because that's what was happening out in clinical practice, and this was co-developed with the Trinity practice education team, and many of our student cohorts are taking this module and really trying to learn how to use telehealth, and they're using it on placement and mimicking what's happening in the clinical sites. We took videos, we did a lot of videos of practical skills in advance of practical classes. And I'm sure many of you are saying, gosh, I remember lots of our students asking for that years ago. And I suppose we just kind of had to step up to the task now this year to make everything a little bit easier, so that we were spending less times in the practical rooms and really focusing on the supervision and the practice for students. And then we could also live stream lectures and practicals for any students who were remote, for example, who had to self-isolate. So next slide, please, Laura. And also there's a big program of pre-screening, COVID screening going on in this college, and this is just showing a room for students for pre-screening. This would be for medical students, pharmacy, physio students. So anytime they're going out on placement, they all have to be screened to ensure they're testing negative for COVID in advance of going on placement, and that's kind of obviously an ongoing on a rolling basis throughout the academic year. Next slide, please, Laura. And other things that have been happening is, I suppose, some of this has been driven by COVID, but also something we wanted to develop anyway within the school. So really developing simulation. So already some of you, some more recent graduates, will have experienced the high fidelity simulation with the mannequins, and this continues to be developed with Dr. Orla O'Shea. We actually ran a clinical placement 1 simulated placement because of the COVID challenges. And this actually was a really innovative initiative that was again led by the practice education team and supported by the teaching staff and practice educators and practice tutors on sites. And we tried to cover the 3 core areas. So again, this was really, being able to focus on some key skills and competencies for that first clinical placement. And we've also been developing simulation around subjective examination skills in the musculoskeletal modules. And I guess it's great to see that we're also getting some funding, and this was Dr. Orla O'Shea who got an IRC New Foundations funding to develop a framework again focusing on the simulation for clinical education. So we're hoping that this will continue to develop over the coming years. And the picture there on the bottom left just shows the new facility in number 26, where students go into simulation rooms. We can record their simulation activities. They can view them back, and we can do feedback sessions. So it really has been a great learning opportunity. So next slide, please. Also just to mention our Alumni awardee for 2020, and this was the second time these awards ran, and this was unfortunately also affected by COVID, because there would have been a live ceremony and a formal ceremony and so on in an event to market, but unfortunately that couldn't happen. But many of you, of course, will know Aisling, and she has spoken at our alumni events, and she received the award for the Outstanding Clinician Alumni Award. And those awards run annually, and alumni can nominate other alumni for those awards, and you know, you receive notifications about that when the time comes. Next slide, please, Laura. Also, just to mention, our students are picking up awards. So, for example, our first year students, both of them won the NUI kind of H.H. Stewart Medical Scholarship Award. So that was a really great achievement, that the two kind of top first year students got those, first and second prize. And then we had a foundation year student, Niamh Hand, along with a medical student, who got a commendation of the Irish Healthcare Awards as part of a project they were involved in for their foundation year elective around transitioning to from an adolescent to an adult diabetes clinic, and that was working with a consultant endocrinologist in Crumlin Hospital. So, you know, again, our students are achieving great things, just as our alumni achieve great things, and we're always very proud of those achievements. Moving on then, Laura, to the next slide. And of course, all of you will know Louise, and she received the President's Teaching Award for Physiotherapy at the November conferring ceremony, and of course, well deserved. And congratulations to Louise. Next slide, please. Other kind of activities that happen. So conferences we know have gone online, and Dr. Grace O'Malley is our star research lecturer with an expertise in paediatric obesity. And this was the European and International Congress on Obesity, and that was due to be held at the Convention Centre, a very significant conference, and they again had to kind of move that all online. And she was the conference chair, and again, she very successfully kind of brought that conference to a kind of a virtual platform. Again, probably with not really as it was intended, but successfully did that. And next slide, please. And of course, I can't finish without mentioning our class of 2020. Again, they suffered from the COVID, the COVID impact, in that we had to move all conferring ceremonies online, and they're shown on YouTube. And unfortunately, this is the best picture we can get of our students in a group. 3 of them were able to take a picture of each other throwing their hats in the air. And this is just a screenshot of the valedictorian, James McCassie, who gave a really lovely speech, and that is available to watch online on the Rcsi YouTube channel. It wasn't quite the same, of course, for those of you who remember your conferring and remember the dinner the night before. Of course, we really missed that, but unfortunately, we really didn't kind of have a choice in terms of having to do that. And next slide, please, Laura. And we did ask we asked the class to send their pictures in of their conferring, and so here we have some. I will notice it was actually all females who sent their pictures in. We didn't get any males, but there you go. And they, you know, lovely pictures there of their graduations and how they celebrated themselves. But we were disappointed, of course, not to have that in-person event. Next slide, please, Laura. So I guess really to wrap up my updates, I put up these pictures really to remind ourselves of what we want to get back to, and hopefully we will get back to it, and we're all feeling hopeful, I guess, with vaccinations coming down the road, but hopefully we'll get back to the packed lecture theatres. Hopefully we'll get back to the students being able to engage in all the clubs and societies, and all the sports and team events which were all cancelled. And of course, many of you remember fondly your social life down at the Swan, which of course also suffers this year. So we hope that we'll return to that very soon. So that's really what I want to say on the highlights and lowlights, a bit of a whistle-stop tour, but just to give you a flavour of our experience of 2020. So What I'm going to do now is, sorry, I should actually mention that we do have a Twitter feed. Twitter was set up about February 2019, actually. So if you want to follow us on Twitter, that's where we try to update on activities that are happening within the school. So that's our Twitter handle there at Rcsi Physio. And we hope that you will follow us and keep up to date with what's going on in the school. So on that note, then, I suppose at this point, I was going to pass over to Sarah Madden, who is online, but unfortunately, due to technical difficulties, is unable to speak to this. And she was going to say a few words about Arwen, and really in terms of remembering Arwen. And so because Sarah, of these technical problems, because Sarah cannot speak, she's asked me to speak on her behalf. I hope I do it justice, but I'll give it a bash. I'm sorry if I get a bit emotional, because this is it's still a little bit, you know, I suppose fresh for her and for her friends and for us in the college. So Arwen, who was not only a classmate but a best friend, sadly lost her battle with her mental health last April. The whole idea behind Share Joy, and this is the initiative that you got information about in your notification. And this is really, I suppose, what we want to try and promote today, but also to remember Arwen. So the whole idea behind Share Joy is to sell previously loved clothes to raise money for mental health organisations such as Ppe House, Mental Health and Fashion, two things Arwen deeply cared for. When on the Physio Society in our third year in college, it was Arwen who came up with the idea of organising charity walks, runs, and we proudly raised a lot of money for Ppe House at the time. She also did her final year project on investigating the benefits of exercise on mental health, and she researched that topic tirelessly. She also absolutely adored fashion. She never arrived to college without wearing something that wasn't purple or didn't sparkle. She was forever trying to get us to go to charity shops instead of Zara, and she bought and sold her entire wardrobe on Depop. So the idea of Share Joy is simple. There are 20 accomplished women who have kindly donated an item of clothing that they once previously loved, and it will be auctioned off on Share Joy's Depop page. All the proceeds will then go to Ppe House, and we hope to continue the initiative throughout the year and get more people involved in continuing to raise money for other mental health charities. You will find all the details on sharejoy.ie or on its Instagram page, and donate even if you don't want to purchase anything. And although it's been a tough year, Arwen would be incredibly proud. And I think it's worth saying, I think Arwen, I mean, Sarah doesn't have it here, but I think Arwen would be incredibly proud of her friends who have done this, and her mother who actually set it up as well. And so hopefully I'd encourage you to go onto the website and have a look. Some amazing items on there, actually. And I suppose this picture, I think, epitomizes Arwen, always smiling, and, you know, said that leaves a big hole for her friends and her family. And so we're thinking of all her friends and her classmates at this time. So I suppose we're going to move on from that sad note, and I'm going to pass on now to our three speakers, and I'm going to pass back to Suzanne, who will just introduce our three speakers.
Helen, thanks very much. The theme of our talks tonight is around COVID, and it gives me great pleasure to introduce our first speaker. So this is Emma Puff, who's a senior physiotherapist in musculoskeletal and emergency medicine in Our Lady of Lourdes Hospital in Drogheda, and who has a particular interest in musculoskeletal and vestibular rehabilitation. So I'll hand over to you now, Emma.
Thanks, Suzanne, and thanks for the invitation to speak tonight. So I'm just going to really talk about the impact of COVID-19 on musculoskeletal physiotherapy, and kind of what it was like a little bit before COVID, I suppose during COVID now, and maybe what it might be like if COVID, or hopefully when COVID ends. So next slide, please, Laura. So I suppose generally in MSK Physio, I work in a trauma centre for the Northeast in Drogheda. So we would get most of our referrals from fracture clinic, a lot of our referrals from ED, some post-op patients, and then of course we have our review patient caseload as well. And then moving on, Laura. So our orthopedic fracture clinic would see somewhere between 17 to 20,000 fracture clinic patients per year, and they come from 5 sites. So from Drogheda, from Our Lady's Hospital Navan, from Cavan General, from Monaghan General, which is just a minor injuries unit, and then from Louth County Hospital as well, which is a minor injuries unit. And I've just put Drogheda and Louth County in purple because we actually would have taken virtual referrals from them before COVID, I suppose, hit. So next slide, please. So we initiated a virtual fracture clinic in Drogheda in 2017, just for the Lord's Hospital initially, and then we just started to expand it towards the end of 2019 to include Louth County Hospital as well. So we were seeing something around 1,500 patients about a year. Roughly 600 or 700 of them were referred for physio. So these were a very strict cohort of patients, simple undisplaced fractures, clavicles, buckles, hands, toes, avulsions, radial heads, and some volar plate injuries. And that was pretty much it and what we were seeing. So I suppose pre-COVID, we were actually quite lucky because we had a lot of these pathways set up already, which definitely helped us. Next slide, please. So roughly 95% of our intervention was face-to-face, about 5% was telehealth, and predominantly because it was these more simple injuries that we were seeing virtually initially, it was only over the phone that we were really able to treat them. Most of our exercise programs we were printing out during a face-to-face intervention, and we're quite old school in Drogheda. We had a really old version of physio tools that didn't have any access to email or anything like that, so it had to be printed and didn't really have any capacity to add extra exercises on or anything like that, so it was fairly limited. And then in terms of our referrals, there was small kind of increases and decreases in our referral rate over the year, so a bit busier over the winter months with ice, and just kind of some dips off with kind of pre-season and things like that. And then next slide, please, Laura. When COVID-19 hit, like everybody else, there's this instant loss of capacity in all healthcare settings. So I suppose for us in MSK physiotherapy, in the acute setting, space was a massive thing, because our outpatient physiotherapy department shut, obviously because of infection control guidelines, but we still were getting quite a high volume of acute fractures into us, and all our post-op patients really still had to be seen. And then obviously in terms of people as well, a lot of our staff were lost, not only to, I suppose, whether it was self-isolating or kind of contracting COVID themselves, but mostly up onto the wards again. And we kind of went into shift work like I think a lot of other physiotherapy departments did. So our MSK physios, we kind of lost them as well. So there was a really big shift within our outpatient department, and obviously within the whole hospital itself, even within the fracture clinics. And then what we noticed is when society tended to open back up after lockdown, we got this really sharp demand in MSK physio again, lots of presentations into ED and a lot more complex presentations. So I suppose in terms of how we could overcome this solution, like we know a quality service is, one that treats the patient, at the right time, in the right place, and by the right person. And we know as physiotherapists, we're more than equipped to treat most musculoskeletal injuries. So it was really imperative that we found a way to deliver physiotherapy to patients outside of the hospital, so kind of within the home. Next slide, please, Laura. So I suppose over the course of COVID, there was a lot of changes, a couple of them that I mentioned there. So we really needed to quite quickly find a way that we could, really implement telehealth within MSK physio while maintaining those key aspects of patient care. So make sure that it was efficient, that it was traceable, that we were still getting that good quality intervention, and that we could evaluate it as well. So always kind of bearing in mind the patient, even though I suppose a lot of the time initially it was kind of like a telehealth or not solution. There wasn't that same which would you rather in the earlier days, but I suppose the creation of these pathways quite rapidly was really quite key. And when I looked at kind of other departments, even within our catchment area, some of the smaller hospitals, completely closed their outpatient physio department. And I think in Drogheda, because of the demand for within our fracture clinics, we really just couldn't afford to completely close. Next slide, please. So this is quite a busy slide really, but really it just depicts what's essential for patient-centered care, and I think this is from one of the HSE's kind of quality care initiatives. So really that time efficiency of the delivery of assessing and treating patients was really important, and then trying to find one platform that we could treat our patients through. So, you know, patients that might come into us, especially hand patients, they might have orthopedic intervention, they might have hand therapy, and they might have physiotherapy as well. So to see if we could integrate that into one platform to make it a little bit easier for them, and, you know, for the patient's carers or next kins, and to try and get them involved completely. Next slide, please. So I suppose what were the challenges? The biggest challenge definitely was the IT infrastructure, the access to computers, laptops, especially with social distancing, or if anyone has been to the physio department of Drogheda, it's quite cramped at the best of times, and all our computers are quite close together. And obviously with social distancing, especially in the earlier waves where I suppose we didn't have that access to PPE, like we weren't wearing masks back kind of in like March, April, May really. So that social distancing element was really, really important. Internet connection was a huge thing. We don't have Wi-Fi in the Lords just yet. And unfortunately, the physiotherapy department is beside radiology, so all the walls are made of lead. So even phone signal, other than the landlines, is quite difficult at the best of times. So they were probably the biggest things. And then, of course, we had to decide what rehabilitation platform we were going to use. There's so many out there, and I'm going to touch on that on the next slide. But also the patient access to IT tools as well. As I mentioned, a lot of our staff were redeployed up onto the wards. With social distancing, that was another challenge. Then we had to obviously look at upskilling staff, you know, training ourselves up as kind of senior physiotherapists and MSK first on telehealth and things like that, and then trying to disseminate that amongst the rest of our colleagues and our staff grades. And then in tandem with the telehealth, there was also the upskilling in terms of respiratory. Most of us work on the wards, so there was all the PPE and all the extra kind of training going on there as well. Patient engagement, I think on the earlier waves this was a little bit easier because people were so grateful that they were still getting intervention. Now we're seeing a little bit more resistance to telehealth, as people I think are getting a little bit fed up, especially people who've had face-to-face appointments, and now we're trying to switch them back to telehealth. And then staff engagement, obviously there was a massive change. You know, I only graduated in 2015, so I'm relatively early on, but some of my other colleagues who are very hands-on, very manual therapy strong, and they were the people who found, I suppose, telehealth a little bit more challenging initially. And then, you know, the big thing is the limitations of a telehealth assessment. Obviously, you know, if there's some things that you're worried about and you just need to get your hands onto a patient to fully assess them, you know, that's not there. And I suppose, how are we going to get people, you know, who needed direct access to a physical assessment back into the hospital? And then, as I mentioned, there was quite sharp changes in referral numbers, and I'm going to chat about that as well. Next slide, please. Next slide, please, Laura. Perfect. So in terms of rehab platforms, there's so many available out there, and we really looked into them quite quickly. So obviously they had to be GDPR or this other ISO approved. The cost, especially when you work in the HSE, is always an issue. We wanted it to be user friendly, and it needed to be adaptable to our service, because that was a big thing. We would see, because we have a maternity unit as well, we would see, you know, any MSK, a lot of the MSK complaints through the maternity hospital, and then they would bounce back to our pelvic health physios, and similarly with our ped service as well. So we really felt that it needed to be adaptable to us, and we needed to be able to trace those patients as we referred them on to other hospitals as well. The HSE really pushed Attend Anywhere, and we tried that initially, but I suppose with Attend Anywhere you can, you know, you can share your screen, and you can have multiple patients on at the same time, but it was the exercise prescription element of that was a real challenge for us. I just kind of tracked out, and we ended up using a program called Slasso, which has your exercise library embedded with the telehealth function. Actually, an Irish physio set it up with her partner who's in kind of IT, and we've been using that. We found it quite good. I suppose the perk of that is when you're on a telehealth call, you can share videos of exercises. And then you can immediately, while you're on the call with the patient, you can be doing up their exercise program, and you can even do your notes on it as well. And it has all the GDPR and everything approved. But if we were to use the platform that the HSE were really pushing with Attend Anywhere, because we would have had to use our old physio tools, which doesn't have email, it really would have slowed us down. So I mean, we were looking at, you know, over 2,000 hours of extra clinical time a year, just when we looked at kind of our numbers 2020 to 2019, if we were to do that for every patient. So you know, this was another kind of challenge along the way. And then next slide, please. So in terms of our referral flow, which I kind of briefly mentioned, so initially when kind of March, April hit, there was a massive increase in demand for our virtual fracture clinic patients, about 400% over, you know, about a week or so. So we ended up developing kind of daily trauma assessment clinics. So one of our senior physiotherapists sitting in the orthopedic kind of virtual triage clinics every morning, which meant that we rapidly expanded our criteria for who we would manage virtually. So from our simple kind of buckles, toes, hand injuries, we were now looking at shoulder dislocations, AC joints, patella dislocations, Weber-A's, and any kind of stable fracture that we could put in a back slab or a boot, or any soft tissue injuries. So that added a whole nother level onto kind of our telehealth assessments, and you were really relying on the ED clinician to have done a really, really good assessment, you know, and making sure, I suppose, in terms of risk, and that we weren't missing anything via our telehealth assessment, which I think for some of our staff grades and definitely some of our students coming through, you know, that's always the big worry, that for all of us, that's something a bit more sinister is going to be missed. And then, as I mentioned, we got this big sharp peak kind of in April, May, when everything started to open back up. Everyone was flocking into ED with a lot more complex referrals. And then the same with every kind of lockdown. So we found even with this lockdown, even though we're back in level 5, our MSK numbers have only dropped maybe about 20% on what they were in December, which is a lot less, I suppose, than we would have hoped. So we've really transitioned back to a lot of telehealth now over the last week or two. So hopefully this will start to level off towards the end of the pandemic. Next slide, please. So in terms of kind of what our successes were, we were really lucky in the Lourdes Hospital. We were able to maintain an efficient MSK physio service throughout the pandemic, which actually meant that towards the end of kind of wave 1, we were actually had like a 1 week or less waiting list for MSK physio service, which is relatively unheard of, where a lot of our MSK colleagues and other sites, you know, were coming back to an extra couple of months onto already long waiting lists. We were able to rapidly and effectively develop our service and establish those multidisciplinary trauma clinics. There was a lot of staff upskilling, and to be fair, most people really did great in terms of the telehealth. And we were also able to facilitate remote working, which has been really actually important to us during this wave, with different staff, whether they're self-isolating or not. There's still a level of remote working that they can do, which is something that really, I suppose, wasn't available to us before, being so hands-on. So I think that's really been a great outcome from this point of view. We also found we had a really high level of engagement across all patient demographics. We were a little bit worried that initially that the older cohort would struggle a little bit more, but like actually we found that they've been one of the best engagers in terms of telehealth, whether it's video calls or phone calls. They have actually engaged really, really well. So if we look just kind of over roughly a 6-month period in Our Lady of Lourdes, we had about 6,000 patient contacts in MSK Physio, and about 2,200 just over that were telehealth, which is really significant given the fact last year it was a lot lower. And then also, and again, we are actually looking at evaluating this. We feel that, you know, it is actually promoting self-management within the patient. They're maybe not relying on the hands-on approach as much. So hopefully that's something maybe that we can bring forward. And then next slide, please, Laura. Yeah, so just kind of a little bit of a summary. The reduction in travel time for the patient has obviously been really, really important for them. We've such a vast catchment area, especially when it comes to our fracture clinics. You know, it wouldn't be unusual for a patient to be driving an hour and a half, an hour and 45 minutes to get to a fracture clinic appointment, and then the waiting around. So there's been a massive time saving there. We've also found that as a physiotherapy service, we're more efficient, and we can do more with the same amount of time. And then we've also found that using a rehabilitation platform, a rehab program, has actually also helped in terms of cost saving and in terms of the efficiency of our service. And then next slide, please, Laura. And then I suppose just kind of to finish up quickly on what MSK physio might look like after COVID. I really think a hybrid model of both face-to-face intervention and telehealth physio appointments, definitely across the public sector, and I know a lot of private practices are looking at this as well. And then, as I mentioned, we're looking at evaluating telehealth within that wider patient cohort. And in Drogheda, we are collaborating with Rcsi and looking into this a little bit as well. So it'll be great to see the results from there. The improved access to CPD has been great. I suppose tonight is an example, and lots of other courses that we would have normally had to trek a little bit for. I mean, hopefully a lot of them will stay online, and then maybe looking at a bit more digital transformation of patient care across, I suppose, all disciplines, hopefully in the future. So that's kind of it, guys. So if you have any questions, I think Suzanne was going to.
Yeah, no, that's brilliant. Emma, thank you so much for that overview. So I think if people have questions, we'll maybe hold them to the end. And if you have a question, feel free to put it into the chat function now, and then we can come back to them. I'm sure Emma will be happy to answer any questions people have. So thank you very much. That was a great presentation. So I'm just going to then introduce our next speaker, who is Simon Galligan. So Simon qualified from Rcsi in 2017 with first class honours. He's currently working as a staff grade physiotherapist in Beaumont Hospital, and Simon's going to share with us his COVID journey. So thanks very much, Simon.
Good evening, I'm Simon, and I'm going to discuss my COVID journey. So next slide, please. So as Suzanne said, I graduated from Rcsi in 2017, and since then I've been working as a staff grade physio in Beaumont. And then since the beginning of the pandemic, I've been primarily been working in the respiratory service. So most of you are aware that our first case of COVID in Ireland was in the 29th of February, and then Beaumont specifically, we had our first cases as inpatients on the 13th of March, which kind of steadily grew throughout the month. And then at the end of the month, on the 30th of March, for 6 weeks, we went into kind of surge capacity where our physio department moved to a 7-day service, which I'll talk about more now in a second. Next slide, please. So early March, we kind of had, I was working on the cardiology ward, and it was around the same time as we saw news coming from Northern Italy of kind of their hospitals being overrun. So there's a huge emphasis on creating space in our hospitals, both one, to try and get our vulnerable patients that are in our hospital system home and in a safe environment so they're unlikely to contract COVID, and then also to have the bed space available if needed. So it was myself and physios in general had a key part of the MDT to ensure safe discharges home. Next slide, please. So unfortunately then, towards the end of the month, I was in contact with a positive case, and it was kind of at the start when cases started coming in, and it was kind of before we had PPE. So I was on 14 days isolation, and I suppose at the time there was a lot of fear and anxiety around COVID because we weren't really familiar with it. I was fearful of spreading it to kind of close ones. I was worried about my colleagues as well in work. Dealing with the anxiety in there, and then I suppose of course there's a level of boredom when you're sitting at home by yourself. Next slide, please. So on my return then from work after self-isolation, I moved into ICU, and while I was off, and people might have seen this photo before, this was going around in the news from an ICU in Northern Italy, and you see multiple patients being prone at once, and it really stood out with me at the time because I suppose in my career in ICU, prior to COVID, I'd seen proning twice, and I suppose it's reserved for those kind of real severe ARDS picture and kind of, you know, last resort therapy. So it definitely it brought COVID to light for me, and then I was greeted with a very similar picture when I got back to Beaumont. Next slide, please. So at the same time, there was a kind of an explosion of evidence coming out, different professional bodies providing, I suppose, how best to manage these patients from a physio perspective. And it really helped us with our upskilling within our department, especially with our MSK colleagues being redeployed. Next slide, please. So as I said briefly earlier, on the 30th of March for 6 weeks to kind of cope with the increase of patients coming in to Beaumont, our physio department moved to a 7-day service. So within ICU, we had 2 teams of 5 physios, and we worked in 2 shifts from 8 in the morning to late in the evening. Also, our ward colleagues did similarly, worked across 7 days a week, but from an 8 to 5 service. And the aims of this was to provide an optimum service to increase patient numbers, to provide rehab to all patients 7 days a week, and then also to kind of adhere to social distancing and be able to have staggered starts. Next slide, please. So this is my team that got me through the few weeks, the few tough weeks at the beginning. We nicknamed ourselves the Mighty Ducks because of our yellow duckbill masks that we were wearing. Next slide, please. So I'll briefly talk about kind of the challenges and the real kind of changes that we saw to our management as respiratory therapists. Next slide, please. So the first thing is aerosol generating procedures, or AGPs. I suppose it's a term that me and a lot of my colleagues have never heard of before pre-COVID, but it's definitely become kind of the buzzword around the place. And when you really look at all what it counts as an AGP, you really see that most of our treatment techniques as respiratory physios are included in that. And then I suppose it links into what appropriate PPE we need to be wearing. Next slide, please. So choosing the correct PPE, I think that was definitely the challenge for me at the beginning. On your right there, you'll see a table that all staff in Beaumont got to carry around on a lanyard to try to help guide us on correct PPE to be worn. And it was, I suppose that was definitely the challenge, to pick what bits to wear and when. Next slide, please. So I was actually the PPE trainer for our department and still am. So I suppose I've been involved in a lot of training on correct donning and doffing of PPE, because there is evidence to support that a lot of staff have been infected from incorrect doffing. Next slide, please. So, and then I suppose some treatments that stood out to us, definitely I found that our COVID patients needed plenty of supplementary oxygen, more unlike other populations that we've treated before. And then there was a lot of issues around our usual treatments that we had to really think about, like active humidification and NIV, I suppose, with the risk of spread to staff, and taking certain precautions. So actually initially in our ICU, we used dry circuits, but unfortunately we found that our patients were kind of getting very sticky secretions and plugging off. So we moved back to active heated circuits again, which I suppose increases the risk of aerosol generating for staff, but I think it was a necessary risk to improve outcomes for our patients. And I suppose we had to be very mindful of having correct PPE, adhering to strict airborne precautions, and having our viral filters in the correct place within our circuits of our ventilators. And that goes for NIV as well. Also, some treatments got taken away from us, like manual hyperinflation and doing valves, because we were trying to avoid ventilator disconnections. So we were definitely more reliant on our ventilator maneuvers, like our ventilator hyperinflation, still using our manual techniques. Again, proning was something that we'd experienced with, but very minimal experience before COVID. So we were using that more and more, and I suppose now it's become our frontline treatment. And definitely this was a lot of evidence around early mobilization for the ICU patient. However, with these COVID patients, we saw that this was delayed significantly due to the significant ARDS they were presenting with. Next slide, please. So another area that really changed for us was our tracheostomy management. We started using closed suction circuits for all our patients. Traditionally, we would only use closed suctions in the ICU setting, but all patients using with tracheostomies were using them on the ward as well with HME filters. Our usual tracheostomy weaning, including like cuff deflation and speaking valves and capping, were no longer used. and patients were promptly decannulated once they were no longer requiring ventilation and pressure supports to try and reduce the risk to staff. Airvos again are something that we would use with all our tracheostomy patients traditionally in Beaumont. However, again, it's an AGP, so we were only using them for if they were absolutely necessary, and trying to use HMEs and Swedish noses and other devices where possible. And of course, with a tracheostomy, there's a huge risk to our non-COVID patients. Within Beaumont Hospital, we have a large tracheostomy population because of our neurosurgical and ENT populations. So I suppose it was trying to reverse barrier them as well, so to reduce their risk of contracting COVID. So what we did during the first wave, so as you can see, if you compare the 6 weeks of our surge working and during the first wave to the same period last year, there wasn't a significant change in the number of new patients that we saw in our ICUs, but there was a significant number of therapy inputs that was provided, and that kind of links back to the kind of high demands that these patients required. So I'd like to thank Laura Byrne, one of our senior respiratory therapists, that provided and collated a lot of this data. So this is the data that was collected during those 6 weeks. So we had 28 patients who were in our ICU at the time. And as you can see, their average age of patient was 53 with an average BMI of 33. And the length of stay for these patients was on average 23.8 days, which is significantly higher than the general population. And the delay to rehab from admission to be commencing rehab was 13 days. So during those 13 days, patients were too unwell for rehab. And then another thing we found that was a lot of our patients required at least on average 2 to 3 physios for a rehab session, which I'll talk about more in a minute. And thankfully, we had a really high survival rate. 80% of our patients made it out to the wards, with them, a lot of them going on either directly home or going on to Clontarf Rehab Hospital for further rehab. Something new that we hadn't seen before was a lot of our patients went out on ventilatory support to the ward on trilogies and trachees, which increased our capacity in ICU for new patients coming in. Next slide, please. So there was plenty of rehab going on. As I mentioned, the rehab was significantly delayed because of prolonged rest failure, high ventilator support, and these patients needed a lot more assistance because of BMI, profound ICU required weakness. So we were really reliant on a lot of our equipment. As you can see in one of the photos there, that's my team and I getting gowned up and ready to go into our COVID ICU with our SAR combilizer, which we used a lot, along with our ledo and our standing hoists, to try and get these patients as quickly and as efficiently as we could. And then this continued on when they went out to the ward. The rehab was quite difficult in the PPE because it was very hands-on and it made it more difficult in the PPE. Next slide, please. So, but thankfully we helped a lot, and this is, I suppose, really where it hit home for me. Being an ICU therapist, we usually see our patients at their worst, and unfortunately don't get to see them at the other end of the journey very often. But thankfully with these COVID patients, a lot of them turned up in the news, like Declan and Andy and Jarek. It's great to read articles about them or see them in the news where they're back living their lives, and that gives me, I suppose, great satisfaction as an ICU therapist to see that. And as teamwork was really important, I suppose. Like everyone here tonight, COVID has hit them really hard, and it's been tough. But I suppose we've worked closely together within our department, looking out for each other. Definitely, the little perks of getting different gifts being dropped off by local businesses has really helped us. Next slide, please. And I suppose ongoing challenges, even since the first wave and throughout the last year. Different things that we have to keep in the back of mind when we go to see every patient is, this was the infection control of each infection status of each patient, choosing the correct PPE appropriately, treatment options again, especially from the respiratory side. We have to, I suppose, weigh up the benefits of a treatment for a patient against the risks to staff. One thing that I've really found in Beaumont is the visitor policy. Definitely over the last few weeks where there's been no visitors, but even during the summer, they were still quite strict on visitors. And I think that's really had an impact on patients and on their moods. And then, of course, for staff themselves, social distancing so that has made it being more, the social side of work has been hit. Next slide, please. But then there is light at the end of the tunnel. Thankfully, I got my first dose of my vaccine on the 8th of Jan. So that's always good, and most of our department has too. Unfortunately, however, I'm actually in isolation at the moment as I tested positive yesterday, but hopefully we get back on track and be able to get the vaccine brought out to the general population, and we can get back to our normal living. Next slide, please. So again, I'd just like to thank Laura Byrne and all the senior respiratory staff at Beaumont Hospital for providing the data that I used tonight, and if anyone has any questions.
That's brilliant. Thanks very much for that, Simon. And it's another excellent presentation. And I have to say, it's very heartening to hear what you, our graduates, are doing on the ground, particularly during this, and the fantastic contribution that you're making during this COVID pandemic. So thanks very much for that. And again, if there are any questions, I'd maybe just ask people to put it into the chat function, and hopefully you can find the chat function. It's just a little box just at the bottom on a little toolbar at the bottom of the Teams screen. So thanks very much, Simon. And I'm just going to introduce then our final speaker for this evening, who again is speaking on this COVID theme, and this is Nessa Malone. And Nessa is a senior physiotherapist working in primary care in Dublin South East. Nessa graduated in 2011 and after a period of time working overseas in Singapore and the States has relocated back to Ireland. So you're very welcome to speak to us now, Emma. Thank you.
Thanks, Suzanne.
No problem.
Well, thanks a million for having me. I guess it's nice to see a few faces, and typical the year I moved back after 9 years overseas, and it's all virtual. So first time I've actually been at the reunion or an alumni event since I moved back. So I guess this is the best way we can do it right now. And it looks like there's a ton of hard work going on in the School of Physiotherapy, and I just noticed that Helen's presentation. So again, thanks a million for all that really hard work and innovation in trying to keep school going. And as a new student on the master's program, I really do appreciate the continuation of the program. And just as well, thanks for a special mention of the swan, because I know we're all missing it. And it was nice to see that Simon put up a token selfie of himself in PPE, because I was going to do that and then I didn't. So it was good to see that someone else did. And just to let everyone know, I had an absolutely fabulous time in Rcsi for my 4 years in physiotherapy, and I'm glad to be back. So I guess moving on, my presentation is just a little bit different in that I have just recently moved back from quite a while overseas, and so I'm going to just talk a little bit about my journey in a way that is a bit different from being in a hospital setting, but here we go. So next slide, please. Laura. I guess I'll start with most important, and this is, well, there is a picture there that was the class of 2011, and that was a picture there a second ago. Huh? I think my internet's really slow. Okay, next slide. So a little bit about myself. I'm from Dublin. I graduated in 2011 from Rcsi School of Physiotherapy. I do have a special interest in neurology and care of the older adult, and there's a little bit of an interest in pelvic health as well. I'm currently a senior physiotherapist with the primary care teams in Dublin South East. So this is a new role, so I'm still I'm getting used to it. So I won't talk too much about it, but I will explain the challenges during COVID. And currently, I did decide during COVID pandemic to undertake my master's in neurology and gerontology in Rcsi. Next slide, please. And then a little bit of experience to date. I have lived in a few different countries. So from 2011, I kind of quickly jumped on the bandwagon with a lot of other classmates in moving to Singapore and undertaking a lot of core clinical rotations in an acute hospital. And then from there, I moved on and did my board exams with actually one or two other of my classmates from Rcsi. And I moved to Charlotte, North Carolina, where I worked for quite a few years in outpatient with complete rehab and sports therapy. And then I missed the hospital setting, as a lot of people do, and moved over to Atrium Health Union, which was a level 2 trauma centre, and worked in the triaging department in the ED, and ultimately moved over to neurology outpatients, where the love of neuro rehab kept going. And now we bring back to 2020. I moved back in March, so right in time for the COVID. And I'm currently working in Churchtown Primary Care team, and with a little bit of extra help being provided in Clonskeagh nursing unit. And next slide, please. So COVID-19 timeline, I mean, pretty similar. We had our lockdown in March, and I had just moved back. I commenced a position with a private practice. During that time, I realised, I really wanted to get back to where I was in the States, which was this neurology and care of the older adults. So I applied to Rcsi for the master's program. I took up a new post with primary care in Churchtown, and that was during the second lockdown. And I currently redeployed to provide physiotherapy service to Clonskeagh nursing unit, and that brings us up to this lockdown 3.0. So a bit of a messy year, but we'll keep going. Next slide, please. So how has COVID changed my practice? I think a big thing there is just, you can see it, PPE. I think I wasn't used to, the extent of what was going to have to happen for physiotherapy to be provided, and PPE was one of the biggest things I had to get used to, along with educating ourselves, I think, on a daily basis. And a lot of the staff, particularly HSE, private practice, wherever you may be working, you might agree that we constantly have emails from ISCP or HSE describing new ways of treating as physiotherapists, and we are trying to keep up to date on a daily basis. So next slide, please. I did a little table, I think I'm getting used to tables with finally being back in college, but I highlighted some of the areas that were a bit different, and obviously some are the same. My journey is a bit different in the last year in that I'm finding it hard to compare and contrast between the States and Ireland, so I'm just going to go with what I've been through. So I started working in private practice, and I kind of put outpatients from the community standpoint in there. The biggest thing was PPE. I do love to be hands-on from a musculoskeletal standpoint and also from a neurological standpoint. So I found the first thing was welcoming patients. I used to shake my patient's hand and trying to make them feel comfortable, but I think that was completely thrown out the window, which was strange. Subjective examinations in private practice and outpatients were all turned over to phone, telehealth, a distance conversation, which, I think I was quick to learn on that, and most physios would be too, that we are able to talk when we want to. So then our initial assessments were obviously divided into two, and sometimes, especially in the community, I'd be phone calling people and doing their subjective examinations, and then from that triaging the need to actually bring them into clinic. And then from a private practice standpoint, we were seeing people as we could. So, obviously prioritization and triaging was a major component of the new skill that we needed to quickly get on board with. And then one thing, and I think one of the other girls has said it, assessments objectively for musculoskeletal, let alone going into care of the older adults, are very difficult. Even just trying to look at someone's foot or hip, if they're on their phone and trying to use Attend Anywhere or Blue Eye or whatever you're trying to use, what platform, it's so difficult to do a proper assessment. And then again, being told our contact time needed to be 15 minutes for close contact, and we're physiotherapists, we're always in close contact. And so I think that hit close to heart, and that was hard. And obviously a productivity standpoint had changed quite dramatically. From a community standpoint, I'm new to the community, but the biggest thing was, going back to care of the older adults, we treat a lot of fear of falling, and now I just figure a lot of them are fear of COVID. So going to some of those homes of older adults who are quite scared to even have someone in their home, but also they are quite thankful to have someone there because they are quite isolated. So from the hospital setting, I guess it's different in the community in that we do see what happens after they discharge from hospital, and isolation is a huge one. And because particularly during lockdown, families can't really go into someone's home and help, we have been some of the first line contact as therapists, occupational physio, speech, public health nurses in particular, doing huge work with these with these patients. And you know, I think all the external services like Alone and Meals on Wheels and anything else that we use in the community are super busy right now because we are referring even more. And I think one of the occupational therapists said to me the other day, she's overrun Alone with referrals because she's so worried about all her clients. And then I think just caregiver and nursing handover has increased dramatically as well, because, you know, we only are seeing patients on a rare basis now. So we are trying to hand over as much as we can to nursing assistants, to nursing staff and caregivers in the home and in the community as well. I know there was a lot of group exercise taking place. Again, I haven't seen this since I got back. So I know there's work going on to provide virtual home exercise programs and group exercise, and that's something that's coming into the future, hopefully. And then the biggest thing to talk about in the community is acute hospital discharges. And I know a lot of the time now, me being redeployed to the nursing unit, I'm not seeing it as much, but in the community, we are seeing a lot of people discharged from the hospital a lot sooner than they probably would have been before, obviously to keep them safe from a health standpoint, but because they don't have as much support going home from family and friends, it is difficult for these patients. So I think primary care and community physiotherapists and the whole MDT are definitely very busy in trying to keep up, trying to keep contact with all of these individuals and making sure that they're comfortable and they're safe and they have all the equipment that they need. And then if I'm moving over to the long stay nursing unit, which I've only been here a few weeks in Clonskea, the biggest thing that I'm looking at right now is post-cocooning, deconditioning, frailty, their cognition, the fear of COVID as well. Trying to provide as much handover as possible to nursing to try and get these patients ambulatory, to try and get them moving, because we can't be present on the floors as much as we want. Another thing that was a problem in nursing units is with the regular lockdowns and then reopening and lockdown again, we can't get that continuity of care that you would want to with some of the patients that do have that rehab potential that you're looking for. So that's been quite a challenge from my standpoint in taking up more of an administrative role and not being so hands-on. And I know the girls have mentioned to me a lot of the time that adult day services and respite, because they're currently not happening, and they're very worried about any of their day hospital patients and their adult day service, their day cares, and what that means for them. So I know that they're calling them regularly and trying to figure out what's happening with them. So lots to say, lots to talk about, but I think I should move on. But those are just kind of three entities that I have worked in the last year. So it's a lot of learning and a lot of developing, and also just learning about the Irish healthcare system all over again. So next slide, please, Laura. So what have I learned? Sorry, busy slide. I guess the biggest thing is altering my expectations. I go in one day, I can see patients, the next day it's telehealth, and I think because it's a nursing unit currently, I just don't know what I'm going to go in for every single day. In the community, it's, we are trying to do telehealth, phone calls, and keep our distance as much as possible. Obviously, we are going and doing home visits and bringing people into clinics that do need it and are a priority one of ours. So telehealth, I think, does have a role, and we have to consider our clients carefully. I have tried it with a few older adults, but from a safety standpoint and just from that, the availability of utilisation of telehealth is harder for them. But consider your client carefully, and getting the caregiver and family input in there is so important as well. And do they need hands-on? I mean, we want to put hands on everyone, but we have to really risk assess and reconsider as physios, do they actually need it? And is it absolutely necessary? And just the MDT, or interdisciplinary team as it's now being called, is even more important during this time. I think just communicating what services do we need, what does this person need, and particularly in the community, it's vital that we are all on the same boat. And hospital discharges, I mean, they're obviously a priority, and there's issues there with COVID and whether they've had tests when they leave and doing 2 weeks isolation, and if they're an absolute priority, what we need to do from the community as regards PPE and safety for them and for us. And just remembering, I think the ISCP keeps talking about this, we are an essential service as long as we're following our strict inspection, prevention, control, and following PPE guidelines. And just, you know, keeping up to date with these. I think daily emails are helping just for me to remember to look back over and do the training and do whatever I need to do to keep up to date. And we do have weekly staff meetings in community, which I find very beneficial. I guess I'll talk a little bit about, before I finish up, personal and career development goals. I mean, I did move back here. I haven't been working in Ireland for almost 9 years. It is difficult to move back, especially during a pandemic. And I have taken up a few different roles, and I'm hoping, you know, that I'm going to stay permanent here. But also, just from a career development standpoint, there's so much out there. And I think there's a lecture on Thursday or Friday, and one of the psychologists who was lecturing said in UCD last year, when he was lecturing in the evenings, he would have maybe 30 students, sometimes less. And now when he's lecturing, he could have over 100 students, and that's because it's all virtual. So, I mean, education, if we can take anything from this, it's that there's so much available. I think weekly I'm talking to other colleagues, and there's webinars with special interest groups, and there's loads going on to develop core group portfolios or whatever you're trying to do. But I decided to undertake the Masters in Neurology and Gerontology with Rcsi, because that's the area of interest, and also because I had an absolutely fabulous time in college there, and I just was very excited to return. I would love to be on campus for my one time a month, just to have some normality. However, right now we are on a virtual platform, and just it is working out quite well in that we do collaborate, and we all have our cameras on and we're talking, and we have had presentations as well. And so I know Rcsi are doing their very best to improve and develop on that all the time, so thanks very much. And then, you know, upskilling your virtual platform skills. We've had tea, coffee mornings in the community, staff meetings over the virtual platforms as well, like Microsoft Teams. And I know it's not ideal, and Christmas parties over virtual platforms, but it is something, and we have to look into the future. And just remembering there's loads of community support for vulnerable clients. I think the best thing that we can do is to find out what they are, what's in our catchment area, and what can we give to our patients to improve this time, because it's obviously a really hard time. And I've kind of been thrown in with the older adults, and that it is quite isolating for them right now. So anyone that you do know that does live alone, just consider that and see if there's anything that we can do to improve their time during COVID. And next slide. And I just put down some mental health awareness information because of the time that's in it. I think it's so important. I'm undertaking a mindfulness course with the Rcsi. I think it's an 8-week course, and that's definitely helping. And just remembering there's lots of meditation apps out there, Rcsi resources, and the Rcsi Students Union. I've been getting lots of emails from them on mental health awareness. And as well, I signed up for an Rcsi My Health. It's actually called Science of Happiness, and it's a really nice thing to do as well, especially if you're Rcsi alumni and have access to all of this stuff. And being more online, your screen time is increasing, but maybe we can utilize it in a beneficial way. Okay, and next slide. And just remember a nice quote, in the States, they're very enthusiastic on quoting on a daily basis. That's my cuddles in the hospital. But we always have to come up with a motivational quote, and your present situation is not your final destination, the best is yet to come. So I really hope that's a good quote for this year, and just to spin a little light at the end of the tunnel on COVID. And last slide, please. And I promised, I have a WhatsApp group with a lot of the Rcsi group from 2011, and I said I would put up lots of photos to embarrass them, but those were the two best ones. So any questions?
Great, Nessa, thank you very much. And it's lovely to hear that you enjoyed your time in Rcsi so much and that you've come back to us. So you're very welcome back. And I think that was a really nice reflection on the changes to practice that many of you have had to experience because of COVID, and really your reflection, particularly on the move away from hands on, which I know will be really challenging for many of you, but is I guess just a necessity at the moment. So we do have some questions, but what I'm going to do, Nessa, is I'm just going to start at the top and work my way down. So the first question is actually for Emma. So Emma, if you maybe want to put on your mic, and if you want to put your camera on, you could do that too. And the question that I have for you, and I just need to scroll back up here again. Yeah, so it's from Louise Keating, and Louise wanted to know what your thoughts were. So she said, well done on achieving your such agile service delivery in response to COVID. And did you observe any difference in establishing a therapeutic alliance with patients, or do you think it had an effect on patients' adherence to rehab plans when appointments moved to online versus face-to-face?
Yeah, it's a really good question. I think in terms of the kind of therapist-patient rapport, I actually found, especially, you know, during the earlier stages, kind of like the beginning, kind of middle of last year, that I actually nearly built a better rapport with patients, especially patients who were cocooning, because a lot of people, I had many patients who lived by themselves. I was the only person who they spoke to, and even if it was just a chit chat about their hair or whatever it was, even if it wasn't physio related, and then the flip side of that is the patients who were struggling. As always, I think in physiotherapy, we tend to, you know, build a really good rapport with our patients, and there has been a lot of people, and a lot of our patients have been struggling with their mental health, and I think being that kind of outlet for them and kind of being able to advise them, whether it's something, as Nessa mentioned, like mindfulness, or whether it's something a little bit more formal, because I mean, for a lot of people, days were going by where they may have only spoken to like their kids or their partner, and then days where they don't want to speak to their partner. So I think that actually, for me, I found I had nearly had a better rapport for some people, and again, there was other people who just needed to people who didn't maybe have access to kind of video calls, who needed to see me face to face, and once they'd seen me once, they're kind of like, you know, I'm happy just to do phone calls, I don't need to see your face again. So I think from a rapport point of view, you know, I think it actually helped with more than anything. And then I suppose from the adherence point of view, I mean, that's kind of the question we all want to know, how compliant are our patients with their exercise program. And the platform that we were using, Salasso, allows patients to actually go in and track their adherence. A lot of patients weren't going in and tracking it, but definitely in the earlier phases, I think people were, you know, they were at home a lot, so they were quite good with their exercises. Now the patients that struggled, that ones that may have struggled already, you know, I did kind of feel that I needed to bring them in, you know, to give them a bit of a harsh talking to, and to see could I motivate them a little bit more. But overall, I mean, we seem to still be getting the same outcomes, and roughly the same number of treatment sessions. So hopefully, you know, the adherence thing wasn't affected too much, but that's definitely something we want to kind of see, can we capture and look into a little bit more.
Yeah, and I suppose it'll just be interesting, as you know, and I think it was in your talk you were saying about, you know, the you know, once the pandemic's over, you know, we'll maybe move to a bit more blended, and it'll be interesting to see whether that rapport, whether that positive experience changes when people have more chance face to face.
Yeah, because we're finding that people are maybe a little less patient with us this time. Our patient department closed there a week and a half ago, and we're finding people where initially they were really grateful just to have any intervention, now they're a little bit less happy if they've been getting a lot of hands-on treatment, for that to be pulled away a little bit. Yeah, so definitely it'll be interesting to see how that pans out in the future.
Great, thanks very much for that, Emma. And I suppose just maybe Simon, I'm just thinking about the situation. You obviously had sort of very sick people that you were working with, and I know you said you sort of were able to track them nearly through the news, but you know, have you had the opportunity to have any contact with people you've got through to the other side?
Not personally, but I suppose a lot of our patients have been reviewed in the post-COVID clinic.
Yeah.
So one of our therapists, Grace, has been working in there, has kind of been feeding back to the staff.
Yeah.
Tracked up. So we are getting information back about them, but I haven't met any of them, unfortunately.
Yeah, but at least you're getting to hear the progress and whatever. Yeah, very good. And then Nessa, I mean, I guess you were probably doing maybe some more remote, so similar to Emma. What was your sort of experiences just in terms of, you know, building rapport with your patients? Oh, I think you might be muted. I think maybe what I might do is just while we're waiting for Nessa, I don't know whether her signal's a little bit slow, but just another question that came in for any of you that came in from Francis, you know, sort of on reflection of your experiences with COVID, are there any things that you will stop doing, that you might start doing, or that you definitely want to continue when we go back to some kind of normality? So
I think I can probably speak for most people to say that I'm looking forward to stopping the social distancing kind of time limit. We're trying to keep it to 15 minutes or less within 2 meters of our patient. So that little bit of time limit can be quite tricky for your more complex patients, and for in vestibular rehab, you know, it's quite very challenging to do your assessment and treatment that quickly. So that's definitely the first thing that I would stop. I think we would definitely try and promote maybe the telehealth a little bit more, and trying to see, can we track maybe adherence a little bit more, and using apps. I know that was stuff, I think in ISCP conference in 2019, that's really what people were starting to look at. So maybe that's something we need to push a little bit more, and seeing, can we give people who maybe don't have access to kind of smartphone devices, how we can give them better access to it. And then, as I mentioned, I think the telehealth, that kind of blended approach, is something that we possibly will continue in MSK, I think, anyway.
Yeah, great. Thanks very much. And I think, you know, we certainly found it in the college that, you know, things that you thought weren't possible have suddenly happened and been really accelerated. So as bad as COVID is, it has had some real positive effects, I think, on how we all do things. So Simon, what about you? Is there anything that you are going to look forward to getting back to? As bad as COVID is, it has had some real positive effects, I think, on how we all do things. So Simon, what about you? Is there anything that you are going to look forward to getting back to? Oh yeah, so you just need, Simon, if you just click your microphone on.
Sorry. Apologies.
Yeah, brilliant. Thank you.
Yeah, we're the same with the, I suppose, with the social distancing and then the PPE as well. But definitely, I think, as I said, the PPE is a challenge, making sure, you know, you're in the right stuff. So it takes another layer away and makes it, but you get to more patient time then when you don't have to think about that aspect as well.
Yeah, and they get to see you as well.
Exactly, yeah.
Yeah. And Nessa, I don't know if you've managed to get your microphone on. Is there anything you'd like to share? Yeah, I think we're maybe just having a couple of challenges with Nessa's just link. So just to say, I've just had a comment as well, just to say to everybody, well done on your presentations. And I'd just like to echo that. You've obviously put a lot of work into them, and I am so impressed that you've given such fantastic presentations. I probably want to steal some of your slides, but thank you very much for taking the time. And it's just a shame that we can't all, I was saying, it's just a shame we can't all meet and have a glass of wine now and have a bit of a decompress post the presentations. But thank you very much to everybody who's contributed this evening. So we just like to encourage everybody to keep in touch, and the event will be available for people to link in because it's been recorded, and if there are any questions that you have, you know, just feel free to link back in with us and keep in touch. And I know Helen is very keen that people will keep in touch both with our Twitter page, and then you've got the alumni email link as well. So Helen, anything else you want to add?
No, I'll keep it very short, just to wrap up everything, and really just to thank all our speakers, thank all of the people who've logged on live, and for those who are going to go back and listen to the recorded version of this, just to remind you of the Twitter handle, which is there, but also if you have any problems or any change of contact details, please email alumni@rcsi.ie. And also, I guess we'd welcome feedback on this type of approach to, it's not a reunion, of course, but you know, kind of a connection with the school. Maybe there is a potential for something like this to run, as well as our actual face-to-face reunion, where of course we could actually get to clink some glasses together and catch up properly in a more socially well, let's say a more social setting and not socially distant setting. So we'll wrap it up there. Thank you very much to everybody, to all our speakers, and to all of you for logging on. And I suppose stay safe, stay well, and keep in touch. Thanks very much.